How did you stupidly make your medical condition worse? It was Valentine's Day and I was sick. Fever, chills, fatigue, nausea, and general misery had kept me home for the day. I'm in the medical field myself and it seemed that the entire region was currently decimated by this year's influenza strain, so no biggie. That weird twinge in my side that started a few days ago was probably a pulled muscle from too many back stretches at the dance studio, right? I had shrugged it off, but now it legitimately hurt with every step I took. Fine, I'll go to the stupid clinic today, but later. First I need some more sleep. I woke up with barely enough time to fling myself out of bed and towards the hall bath, getting there just in time to vomit more fluids than I thought I'd consumed. Also, I noticed the lack of the coughing or congestion that typically arrives with the flu, so maybe there's something else going on. That pain is right over my left kidney, but it's probably nothing. Okay, then, I should probably get my pukey butt to the nearest urgent care clinic, and I definitely shouldn't be driving. I called husband and explained the current circumstances, asking him to come home and take me to the doctors. Because I'm a stubborn paramedic who hates it when people go directly to the hospital's emergency room for ridiculously minor things, I went to an urgent care clinic near my house. I expected to have a PA confirm my self-diagnosis and tell me to tough it out with Flonase and Mucinex, because treating a virus like influenza usually means managing the symptoms and trying to decrease the discomfort. The PA took a quick look at me and told me to go to the ER. As is my wont, I protested, but she was serious enough that I was actually considering going. I finally agreed to go just to make husband more comfortable with the situation, but I fully expected that this was a waste of time and hours of my life I'd never get back. By the time we arrive I've accepted that I have pyelonephritis, a kidney infection, but still feel the ER is overkill. After triage and a preemptive blood draw for labs, I was taken to a room. I didn't even have time to change into the stupid, drafty, butt-bearing gown provided before my nurse arrived to start a saline drip to treat my dehydration. Cool, pretty standard stuff so far. Several minutes later I was talking with the physician about my signs and symptoms when there's a perfunctory knock at the door and a lab tech entered to hand deliver my test results. Uh-oh. This can't be good. I watch her eyes widen as she reads the CBC values, and then she announces, "Yeah, we're gonna be keeping you overnight." She then orders a second 4-line, hardcore painkillers, and a massive dose of 4 antibiotics and leaves me trying to figure out what just happened through a pain and narcotic haze. Well, okay, it is around 8 in the evening at this point, so overnight observation seems reasonable. I expect a patient transport tech to come fetch me and take me upstairs to a general medical ward. Instead, an RN starts to wheel my bed towards the elevator, which is really weird. Nurses usually have better things to do than move patients between wards. At this point, I hadn't been told anything about what was wrong or where I was going, but I start to get somewhat nervous as I'm moved into an intensive care unit. I rationalize this by telling myself that they must be out of general med/surge beds and so I'm being put into this room as overflow. It's a huge room, and my nurse appears to have only one patient, me. Man, this crap keeps getting weirder. Within minutes, I'm hooked up to every type of monitor I've ever attached to a patient and then some, plus I've got a transmitting cardiac telemetry monitor stuck to me, too. My nurse goes through the endless list of health history, lifestyle, and medication questions, and asks husband to bring my birth control pills from home. What the F? I have pyelonephritis, and this is ridiculous. Is that really necessary? I mean, I'll be home tomorrow. She looks at me with both amusement and pity, and then continues bustling about the room doing important nursing tasks. Yeah, I was wrong. It wasn't the flu. She shattered my last layer of denial by showing me my lab results, and holy effing crap, my white count is 28.77. I'm effing dying. A normal white blood cell value is between 3 and 10, and I was so far past that I was in critical condition. Turns out I was in septic shock in addition to renal failure and E. coli septicemia, and had I waited a few more hours to seek medical help I'd have probably been toast. EFF. I couldn't deny the seriousness of the situation anymore, but I just felt too crappy to even care. After a sleepless night and an endless parade of nurses, CNAs, phlebotomists, X-ray/imaging techs, and a priest, I finally met my attending physician and a whole crew of residents. I'm exhausted, grumpy, and in pain, but apparently I still need to be lectured on how dangerously close to death I'd gotten by waiting to seek help, despite the fact that I had practically zero reason to suspect so. Anyway, afterwards we have a nice, roundtable discussion of my treatment plan, how the antibiotics are working, and about how I'm probably going to be just fine in a couple days. Ha, wrong again. Turns out the massive infusion of fluids and treatments to kickstart my kidneys caused my lungs to fill with fluid, resulting in a condition called ARDS in which, well, you can't freaking breathe. The alveoli, those little sacs in your lungs that do the CO2/oxygen exchanging, were effectively flooded, meaning that no matter how much air you're gulping in you simply can't extract the amount of oxygen needed to live without medical intervention. I really didn't want to end up intubated with a ventilator breathing for me, and my awesome attending let me try the less dramatic option of diuretics and staying awake to remember to breathe. It sucked. Seriously, the worst, most miserable experience I've been through. But it worked, and on the morning of day 5 in the hospital I got transferred to a general medical ward. It was blessedly quiet, at least until I dozed off and my oxygen shots would drop again and then the monitor would shriek me awake. I was slowly weaned off of supplemental oxygen over the next few days, and eventually got to go home on the condition that I'd sleep with a little extra oxygen at night. The scariest thing about the whole experience was how it snuck up on me so stealthily. Our working theory is that I must have had a completely asymptomatic UTI that progressed to my kidneys, but we'll probably never know for sure. I mean, UTIs aren't generally subtle, and if I'd even suspected I had one, I'd have gone to urgent care for a UA and an antibiotic script. I knew what to look for, and it still nearly managed to end me. I'm fine now, feeling much better. I'm definitely still tired and lack stamina, but I'd say I'm at about 85%, and it shouldn't be too long until I'm as completely healthy as I'm likely to get. I may have lost some kidney function, so I'll continue to go in for routine blood tests, but we're very optimistic about how the most recent scans looked.